improve your gut health and improve your gut inflammation. But before you get started, let me introduce myself. I'm Dr. Anshul Gupta. I am a former Cleveland Clinic functional medicine physician. I help people with chronic diseases improve their health. You might have seen some of my videos, so that's what we are doing right now, doing live sessions to help you out. So please, first of all, introduce yourself in the chat section where you are joining us from. This is a fun exercise that I like to do when I'm starting my live sessions, because this is a nice way to know where everybody is joining us from, because more and more people are joining us. So it always is nice to know where people are coming from. And if you want to share anything about you, like, if what problems what problems you're going through or any other things, then that will always be nice. But at least share where you're joining us from, so that way I know where you're coming. And then as more people join in, we will get started with our session. As I said, today's session is about gut. So a lot of people might know that gut is where everything lies, especially our immune system. A lot of people who have inflammation issues, they are looking at other places to heal, but they never get better because they have not healed their gut. So leaky gut is a very prominent term. If you do not know it, please start searching about leaky gut. You'll be astonished about the research and how much leaky gut has to play a role in terms of your health. So we are going to talk about gut inflammation. We are going to talk about how to improve it by natural methods today. All that stuff will be coming up some soon. All right. So Crystal is joining us from Nevada. Priyanka is joining us from Delhi, India. Akshay from again Delhi. Kalpana is joining us from Mumbai. Shaija is joining us from India. So that is great. Welcome everybody over here. Terry is joining us from California. Mary is joining us from Tennessee. So welcome over here, guys. Again, very, very nice to see that people are joining us from all over the place. So please keep introducing yourself. Luz is joining us from LA. Fatma is joining us from Kenya. So that is awesome. Again, Dilair, Niranjan, Ankita is joining us from India. Sherry is joining us from Illinois. So that is great. So awesome. So thank you so much, for Terry, for telling us that, this is really helpful for you. So hopefully what we are sharing over here will be helpful for each and every person over here. So about introduction about the today's session, as I said, it is all about gut inflammation, gut related issues is what we're going to talk about today. And obviously I'm going to take a Q&A session in the end. So we will try to cover as many questions of yours. So yes, once we're done with introductions, please post your questions after that, so that I will try to cover as many questions as possible. Sometimes, again, as you know, it is not possible to cover all the questions. That's the reason I have made this effort of doing these live sessions on the regular basis. So hopefully I can answer your questions as much as I can. So every Thursday, show up over here. So at least you will definitely gain new information. Plus, at the same time, you will also get some of your questions answered, hopefully. And today, we are also going to give you a handout in the end about a daily routine that you can follow that is going to help heal your gut. It is a free download. So that is going to be your kind of a bonus at the end of the session today. So, stay till the end so you can get a link to that handout. I think that will be useful for you. I like these small handouts where that tells you can put it on your refrigerator and tells you what is going on and how you can implement the plan. So awesome. So we'll just wait. I think more people have joined in. Karen is joining us from Tampa. People are joining us from Jersey. So that's great. Marjan is joining us from Pakistan. So awesome. A lot of people are joining us from India, Qatar. Somebody is joining us from Doha. Awesome. So from California, Monera, Greece. So great. This is so awesome that people join us from all over the globe. And that's the power that we all have together, that we can together heal our bodies and together get better. And that's the whole goal, of these online platforms, that we can join from all over the globe. And the good part is that luckily our channel actually gets visitors from again across the globe, so not only from one area. So I'm really thankful for that. And that's the reason I try to kind of create content which is pertinent to people across the globe, because obviously cultural differences are there. Certain foods are not available in certain places. I try my level best. I know I'm not perfect. I try to be perfect and try to cover as much as possible, but it is not perfection. Sometimes that doesn't happen. So yes, I apologize for that. But again, the goal is to get as much information which is relevant to you. Okay, I think it's time for us to start. So as I said, I'm going to do a presentation initially, so that it's so that you know exactly what I'm talking about, how to heal the gut, why it is important, and then after that is where I'm going to open up for a Q&A session. All right, guys. So let's go to the presentation. All right, so let's get all started. So as I said, so I would like you to give you this brief presentation of how healing your gut can eliminate inflammation. Why is it so important to actually heal your gut? So I'm going to share my 3-step process that is going to help you to heal gut, which will obviously include some natural lifestyle changes, as well as, we are going to talk about certain supplements that can be useful for you. So, as you know, I worked at the Cleveland Clinic Functional Medicine Department. This is where I've seen thousands of patients, and then help them out through a functional medicine approach to heal their body. All right, so let's get started. So first, actually, I want to take this poll. Okay, let's start with honesty in terms of raise your hand. If you have had any of these symptoms in the last, like, let's say, past 1 month or 30 days or so. You have bloating. You feel bloated after meals, or you feel energy crashes in the evening or in the afternoon, or even in the morning. You feel that your energy is low. You have difficulty concentrating, or you have brain fog issues. You feel more anxious, more stressed out. Then you have skin issues, like eczema, or let's say any kind of rashes on your skin. And you're getting more and more sick, like any kind of virus, comes along and it knocks you over. So if you have any of these symptoms that you have experienced in the last 30 days, please share in the chat section, in the comment section, if you have these. So I will give you some time to share this, so that we know, like, how many people actually have these symptoms, which they have experienced. And again, we are just kind of sharing it so that we know what is going on, and how so many people suffer from gut issues. And what they don't know is that a lot of these symptoms might be related to their gut, and they have no idea that it is their gut which is causing these symptoms, and they are looking for other reasons for it. So yes, please keep sharing, so I know exactly how many people have gone through it, and you will know that you are not alone in this journey. More and more people, and a lot of people, suffer from these symptoms, and they don't know about it also. So share in the chat section. And as I said, why is it so important, right? Because 70% of people, of adults, have gut related problems, or any of these symptoms that you shared with me right now is just a snapshot that your gut is not functioning optimally. Okay, so people think, it is my hormones, it is, like in my head, or it is in my genetics, or they're looking for fancy testing to check for genetics or hormones and stuff, but actually it is in your gut. So 70% of your problems are because of your gut. So until you fix your gut, doesn't matter how fancy of IVs or ozone therapies or stem cell therapies you do, you're not going to get better, because gut needs to be fixed first. Okay. So here's some shocking statistics that, I want to share. A lot of people are not even aware of it. There are 100 plus trillion bacteria that lives in your gut. Okay. Now, just imagine that, you have, your body is made of organs, and organs are made from cells. There are more external bacteria that lives in your gut than your own body cells. So that's the impact. That's the impact of these bacteria, which is there on our own body, that we have more bacteria living in our body than actually our own cells. Okay. 70% of our immune system lives in our gut. Okay. That's the reason a lot of people with gut issues will have several infections, because, or they have more autoimmune diseases, because 70% of our immune system lives over there. 90% of your serotonin, which is your happy hormone, is made in the gut, right? You think it is in your brain, and that's the reason you have depression. Well, serotonin is actually made in your gut. Okay. And 70% of people have compromised gut, right? You might not have the typical gut in, symptoms of having bloating, constipation, diarrhea, or no stomach issues, but there are indirect signs, right? All the signs that we shared with you before, those are indirect signs or symptoms that your gut is compromised. And 70%, and this is all research backed, guys. I'm not just making up these numbers. So these are really important. Okay. And so ultimately, when you have gut inflammation, which actually leads to chronic inflammation inside your body and destroys it. Okay. So that's the reason I'm so stressing importance of healing your gut here, because without healing your gut, you cannot eliminate inflammation from your body. Okay. And obviously there are a lot of different protocols. I'm going to share my 3-step process over here to kind of make it very simpler for you, so at least you can implement it. Okay. So it is simple yet very powerful. So 3 simple steps are: 1. Okay. First step is starve. All right. So you have bad bacteria that happens in your gut, right? All that trillions of bacteria lives in the gut. Now, over the course of time, we start replacing the good bacteria with the bad bacteria. Bad bacteria overgrowth is there, then there is candidal overgrowth is there, and then there is parasites which enter in our gut, right? So we have to starve and die this bad bacteria which is present in the gut. Then we have to start feeding the good bacteria. Okay. So that more and more good bacteria lives, and whatever is left in your gut, which is all the good bacteria, it thrives more. And then third is the healing part of it. All that damage in the gut, which has happened because of the bad bacteria or the inflammatory markers from that bad bacteria, we need to repair and heal your gut. Okay. So that's simple process that I would like you to kind of teach you today. These 3 steps: first starve, then feed, and then repair or heal. Okay. So first step, starve. What do you mean by starve? That means we stop giving the bad foods on which the bad bacteria feeds. Kind of very simple, a strategy that I have. What are these foods which feed specifically the growth of bad bacteria and candida in your gut? Is first of all processed foods. Okay. Fast food, packaged meals, processed meats, all of these things feed your bad bacteria. So stop eating them. Then is the added sugars. Okay. So all those sodas and sugary foods, candies, even high sugary juices and things, they again feed the bad bacteria, promote their growth, and promote the candida. So stop eating them. Then refined grains. Okay. So which is the white bread, which is the pasta, which are the pastries. Lot of refined grains are being used in lot of places. Refined flour. So make sure you're not using any of these things. Then comes excessive alcohol, which is more than 1 to 2 drinks in a day. Okay. So again, eliminate that. And artificial sweeteners. Over here, aspartame, sucralose, saccharin, all of those are artificial sweeteners. Most people, because they want to lose weight or they don't want to get too much sugar, they are drinking those Coke Zeros, or zero sugar drinks. But what they don't realize, these sugary things still have artificial sweeteners, which will damage your gut. The 2 artificial sweeteners actually are stevia and monk fruit. Those are the 2 which are safer side, but all the other artificial sweeteners are damaging your gut, and it is very important for you to eliminate them completely. Okay. So first step, starve. Okay. So these 5 foods: starve your, feed the bad bacteria and the candida. So eliminate them completely from your diet. Now, obviously, the next question is that, well, Dr. Gupta, it is so difficult to follow this diet and very difficult to remove these foods, all the time. I totally understand that. Okay. So this is where my 80-20 rule applies. Basically, because this is not a short, 100-meter sprint we are doing with you. This is a new lifestyle for you, right? So If you follow this diet for at least 80%, where you are able to eliminate majority of these food 80% of your times, that is actually really good. Research suggests that consistency is the key. So if you are able to eliminate it 80% of the time, then you are really good. Then the rest 20%, yes, sometimes these food we have no control over it. And if you have them sometimes, that is okay. But not more than the 20% times. Okay, so that's the step one, very simple on that. Then the step two is feed. Okay, now remember, we have to feed the good bacteria, and the good bacteria likes healthy foods. In this category, two specific food categories are very important. One is prebiotic foods and one is the probiotic foods. Now probiotics, I think everybody knows, right? What is probiotics? Basically beneficial good bacteria that we are giving to your gut, right? So primary sources are non-dairy yogurts. Okay, and yogurt is one of the most common probiotic food consumed worldwide. I propagate non-dairy yogurts. There are several recipes online that you can utilize. You can make it from coconut milk, almond milk, very good for you. Kombuchas are good options for probiotic foods. Fermented vegetables like sauerkraut, kimchi. So, and then even there are like fermented vegetables that you can make on your home. Again, several recipes are there online that you can do. Okay, very important to introduce probiotic foods so that we can feed the good bacteria. Now, what are prebiotic foods? Basically, prebiotics are the food for the good bacteria. So now what happens in majority of the people is that they're taking too many probiotic supplements or they are eating probiotic foods, but that doesn't stick in your gut. The reason being you are not consuming prebiotic foods because that is the food which is the food that the probiotic bacteria or the good bacteria feeds on. Okay, so very important that you include prebiotic foods on the daily basis in your diet. What are the prebiotic foods? These are green bananas, very good prebiotic foods. Steel cut oats. Okay, we are not talking about instant oats. Steel cut oats, okay, are really good as prebiotic foods. Chicory roots and artichokes are also good. Legumes, lentils, chickpeas, again they have good prebiotic soluble and insoluble fibers over there. Apple with their skin. Okay, apple has quercetin, plus apple also has pectin, which is a soluble fiber, which is also a great prebiotic food. Onions and garlics again are also great prebiotic foods. Okay, so make sure again you are including these prebiotic foods because without them your good bacteria is not going to stay in your gut. So include them on the regular basis. So this is the step two. In this step two, we also want to include at the same time, heal. The step three is the heal process where we actually want to heal your gut. Okay, and how do you heal it? By including the anti-inflammatory foods, right? So the step three is healing foods that again we need to include. What are these anti-inflammatory foods? One of them is turmeric and ginger. These are two great anti-inflammatory supplements that we want to include. You can include them as spices in your food. So turmeric and ginger is really great. We have thousands of research studies which shows that they have so much beneficial effect on reducing gut inflammation in your body. So make sure you're including turmeric or ginger in your food when you're cooking, or you can make ginger and turmeric teas out of it. You can also add them to your smoothies. So absolutely you can do that, right? Then other are berries. Blueberries, strawberries, blackberries are again powerful anti-inflammatory foods. The biggest advantage of blueberries and strawberries is that even when they are frozen, they do not lose their antioxidants. So a lot of countries where blueberries are not readily available, frozen might be easily available. So you can use that, and that is still going to help you reduce your inflammation. Then leafy greens, spinach, kale, chard, or any other local greens that are available. Those are very potent anti-inflammatory foods. The reason being they're very high in antioxidant compounds like quercetin. They're very high in minerals like vitamin K, like calcium, even vitamin C. These are powerful anti-inflammatory compound, which is going to heal your gut. Okay. Then make sure you're including your omega-3s, which will be your fatty fishes. Okay, so fatty fishes are very important to heal your gut, especially as they provide you omega-3s. If you are vegan or vegetarian, then try to include your chia seeds. Again, very important to heal your gut. Chia seeds, flax seeds, those are all good sources of omega-3s that you can include. Okay. So this is the step 3 where you include the healing foods for your gut, which is all these anti-inflammatory foods, which reduces inflammation as well as heal your food simultaneously. Okay. So very important to include those. Over here, also good quality protein is very important because that provides you the right amino acids, right? The right amino acids are L-glutamine, very important for your gut. Okay. So again, if you can eat fish, that is great. Chicken is also a good source. If you are vegan or vegetarian, you have to rely on your lentils, legumes, chickpeas, beans. Those are again good sources of protein that is going to help you heal your gut that way. Okay. So these are the 3 steps. These are 3 categories of food that you these are the 3 categories of food you have to make sure that you are including in your diet. Very, very important because they are going to help the healing the gut. Okay. So first is that removing the bad foods. Second is, including prebiotic and probiotic rich foods. The third is anti-inflammatory foods. So that is going to help you start healing your gut right away. Okay. Very, very important. All these 3 steps are done with the food itself. Now, food alone, like sometimes or a lot of times is not able to heal your gut. This is where some essential supplements can be very, very useful for you. Okay. So as you know, we have created these essential supplements. One of them is Gut Restore. What is Gut Restore? Gut Restore provides you healing environment for your gut. It has L-glutamine, which again helps to heal the gut lining, which has been causing leaky gut issues. Then it has marshmallow root. Then it has aloe vera. It has DGL, which is the D-glyceride licorice over there. So a lot of these good things are there, which helps to heal your gut. Okay. Now, if you don't have access to the Gut Restore supplement that we have, at least get a combination of L-glutamine. Then you need to get aloe vera. Then you need to get marshmallow roots, and then you need to get DGL. Okay. So all of these supplements are very essential to healing the gut. So if you, and we have combined them all in Gut Restore supplement, which is available worldwide. And if you don't want to get it, then, all these, get them supplements separately. Next one is Probio Restore, which is a blend of probiotics. You can eat probiotic rich foods, but there are specific strains of probiotics which are not easily available through food, like specific varieties of bifidobacterium, like lactobacillus and things. And plus, sometimes our gut needs very high doses of probiotics, between 30 to 50 billion. This is where the Probio Restore is kind of very unique, that it provides you the right strains which is needed by your gut to lower inflammation, heal the gut, as well as in the right quantities, like, 30 to 50 billion. So probiotics include that as a supplement to heal your gut. Next one is InflamaPro, right? To reduce the inflammation in the gut, you need inflammation reducing substances. Like, we mentioned turmeric, we mentioned ginger, then there is quercetin, then there is rosmarinic acid, boswellia. All of these are very powerful herbs which has helped to heal the gut as supplements. We have combined them all together in InflamaPro, but you can take them separately also if you do not have access to the InflamaPro supplement. Okay, so very, very important. Again, this supplement can reduce inflammation in your gut very, very quickly. And the last one is omegas. Okay, right? As I said, like, let's say if you're a vegan or vegetarian, you cannot eat fish or any animal products, then an omega-3 supplement is a very good way to keep your omegas in good levels, as well as also keep them in good shape. Now, again, a lot of people have high mercury levels because of the fish. Okay, because the fish they're eating can be high in mercury, so they don't want to eat fish. And again, omega-3 supplement is again a good way to doing it. Now we make sure that this omega-3 that we are making is free from mercury, so there is no mercury in it, so you can take it very safely and easily. Okay, so these are the supplements which I will recommend along with the diet, so that you can heal your gut very quickly. Especially you can reduce your gut inflammation very quickly that way. Okay. So what does a routine look like, right? How can you heal your gut? What you should be eating and things. So let me give you this daily routine. So this is the morning ritual, right? As you guys know, morning and night time is very important, especially the morning time, because your body is waking up. And if you get your body the right things, it heals it. Okay. So different morning routines are there for different things. Some for reducing inflammation, some for gut, some for giving you energy and things. So this particular drink is for gut healing, which, a lot of my patients have seen benefit from. So as soon as you wake up in the morning, do not drink your coffee or do not drink your tea, but do this morning tea. Specifically, if you feel in the morning a lot of bloating, if you have a lot of acid reflux, you feel like, stomach upset, then this drink will be really good. So for this, basically, you need 1 cup of warm water, 1 teaspoon of aloe vera juice. Then you need a half an inch of grated ginger, 1 teaspoon of chia seeds, which are pre-soaked overnight, and then half a teaspoon of raw honey, and then half a teaspoon of fresh lemon water. Basically, then you mix all of these ingredients into warm water. Okay. Make sure it is not boiling water because that destroys the good antioxidants and healing properties of these things. So just warm water, mix all of these ingredients, let it sit for 5 minutes so that all the antioxidants, all the vitamins, all the healing properties of things are absorbed. And then either you can strain it, if you want to do it, and then you can drink it very slowly in the next 5 to 10 minutes, so that again it doesn't irritate your gut, actually soothes your gut. Okay. And this will definitely improve your bloating, improve your digestion, and improve overall gut health. Okay. So this is the way you start your morning routine. So this is what I start with. Okay. So basically, what do you do? What does the plan look like? As I said, for the morning, do the gut healing drink, which I spoke to you about. Then breakfast is very important. High, good quality breakfast, which is high in protein and also high in prebiotic foods. Okay, which includes your vegetables. Okay, so either you can make a smoothie which has good quality protein into it, add a lot of veggies, add a lot of berries, and add ginger into it. Perfect morning routine. Okay, that gives you everything that your gut needs to start your morning. If you don't want to do smoothies, then you can do dairy free yogurt with some berries or some ground flax seeds. Again, this gives you antioxidants, that gives you prebiotics, it gives you omega 3s as well as probiotics. Okay, so you can do this also, or you can do steel cut oats with vegetables in the morning, which again will give you the prebiotics, which will give you the probiotics, antioxidants. So breakfast is very important. Don't skip your breakfast. Okay, either do morning good quality smoothie or do these gut healing things for the morning breakfast. Lunch is making sure you're eating vegetables. Okay. Can be a large salad with some fermented vegetables. I usually do a large salad with a lot of greens, cucumbers, tomatoes, some avocado in there. And also I throw in some fermented vegetables. I love kimchi, so I throw in kimchi sometimes. I add sauerkraut sometimes. So that way I'm getting all these probiotic rich foods, which are also good for digestion actually, because these kimchis and sauerkrauts have some digestion improving properties also. And then make sure you're adding good quality protein to get those amino acids, which can be again your fish or chicken, or it can be your legumes, lentils, or chickpeas. Okay. And then you can have either steel cut oats, or you can have some quinoa or some brown rice or millets with it. That again will be gluten free grains, which are not simple carbohydrates but dense carbohydrates. And for dinner, again, focus a lot on vegetables as well as protein. Try to skip grains in the dinner and have an early dinner. Okay. So again, typically I like to have cooked vegetables for my dinner because that helps with my gut. For lunch, I can have a salad, but for dinner, I will either have a small salad with some cooked vegetables, which I will just saute, like some greens or some peppers and onions and garlics and ginger. So those are all again gut healing foods. Okay. So I combine all of them like, in a stir fry, like ginger, garlic, onions, and then some greens into it, and peppers and all those things. So you can kind of do that and then have your lean protein with it, which again, you can be a chicken or fish, or, if you have grass fed meats, those are fine to do. And if you're vegan or vegetarian, try to do chickpeas or beans or lentils in a smaller quantity, as your protein, and try to stay away from grains. If you're eating grains, very small quantities of quinoa or brown rice. Okay. Try to stay away from millets or any gluten in the dinner time. All right. So that's the gut healing protocol, like a routine that you can follow, as I said, starting with a great morning, and then including foods which are gut healing for your lunches and dinners, and then include supplements in between. That will definitely going to be very useful. What I've typically seen with my patients is that, within 1 week, they will definitely see an improvement in their bloating, better digestion. Within 2 to 3 weeks, you will see better bowel movements. you will see that your food cravings have reduced significantly. By 4 to 6 weeks, you will feel your mood is calmer, you have more energy, less inflammation in the body in general. That obviously accounts for reduced joint pain and clearer skin. Okay, so this is the timeline in terms of follow this for a month or so, and you should see a great difference with it. Okay. Now, when to go deeper, right? Like a lot of people say that, okay, well, I've been doing these things, or this is a basic protocol. Well, there can be more things. Okay. You might have something called SIBO, which is small intestinal bacterial overgrowth. You might have something called C4, which is a small intestinal fungal overgrowth. You might have, a parasite in the gut that you are not aware of. You might already have an advanced case of leaky gut that you are not aware of. Okay, so for these things, like this is where you might need to work, with a professional, like a functional medicine professional who can go deeper into your gut and help you to heal it. There are advanced gut tests that can be checked for leaky gut, advanced test to check for SIBO, C4, as well as your gut microbiome, what kind of bacteria is present in your gut, whether it is good bacteria or bad bacteria. So we have tests to check for all of those things. And good part is that, they are available world over. So wherever you are, we can help you to get those testing done. Okay. So work with a functional medicine provider. We also provide a worldwide virtual consultation. So we work with people all over the world. So if you're interested in working with us, please reach out to us. Information will be on our website. Okay. So this is a gut wellness bundle, which I was talking to you about, right? Which has the gut restore powder, which is going to help you with your leaky gut and inflammation. Omega, which is going to provide you the right omega-3s, probiotics, a special probiotic supplement with high dose probiotics, and it has the magnesium supplement, which is going to support your gut health also. And then on top of that, you can add InflammaPro to reduce inflammation. Okay. So where to get them now? You can go on our website, to buy these supplements. We ship worldwide, so you can do it. As well as, if you want to work with us, shoot us an email. My manager can help you with more information on it. But more importantly, I just wanted to share with you, this exact blueprint of how to heal your gut, and utilizing food as a medicine, and then using supplements to as a cherry on the top, so that you can heal your gut very, very quickly. And as you know, I'm always available to help you out. So if you need my help, just shoot us an email. More than happy to help you out. So this is all the information. I hope this presentation is useful. We will open up for questions so that, whatever questions you have, I can answer those for you. So please post your questions in the chat section so we can go over those. All right, so let me answer some of your questions. So yes, now this is a good time to start posting your questions into the chat section. So then I can try to answer as many of your questions as possible. So let's get started with that. So somebody has this question, what do you think about vegetarian keto diet with intermittent fasting? I'm trying to for leaky gut with Hashimoto's disease. So vegetarian keto diet, right? That's a big question in itself, because the keto diet means that you are eating too many fats, but, we have to make sure that you are doing a healthy version of keto diet, because there is, people start eating a lot of butters and, like a lot of fried foods and other bad foods, which are high in fats. We don't want that. If you're doing a vegetarian keto diet, first of all, it is difficult to get the right fat source and the right proteins. But if you are able to do it, that's great. But then make sure you're doing a healthy version of keto diet. Now, the keto diet is sometimes backfires for the gut issues because some people, the keto diet is a little bit more difficult to digest, and some people will feel more diarrhea episode, or they will have more stomach upset. But if that is not happening, I think that's fine to do. You can certainly try to do that. But again, very important to do the healthier keto diet. Intermittent fasting is a two-edged sword for Hashimoto's disease. Okay, so intermittent fasting, if you're doing for longer basis, research shows that intermittent fasting can be bad. That means if you're going beyond 18 hours, then it can backfire, and actually it triggers your immune system to make it worse. Okay. So actually, just as a snapshot, one video is coming up soon next week, which are talking about these flare-ups, and where I do talk about intermittent fasting. So make sure that you do check out our next week's video. So I'm already giving you that insider information. But if you're doing intermittent fasting between 12 to 14 hours, then yes, for most people it is good. But if you're doing beyond it, it can be actually damaging for Hashimoto's disease. So that's about that. Now let's see question that I can answer over here. Constipation issues. Okay. So constipation again is a very major problem. It can be multifactorial. So first of all, I'm just going to give you some dietary advices. So for dietary advices, make sure you're eating more fiber. A lot of people think that eating more fiber just means more vegetables, but sometimes you need to add other kinds of fiber, especially like chia seeds or flax seeds. Those have good amount of fiber. If you're eating grains, then whole grains are again very important. Again, whole grains are very misleading terminologies which are present in our current environment, where people think that anything which has been written as whole grains is real, but you have to actually look at what they are actually adding in those whole grains. Okay, so it has to have the complete covering of the grains. So whole grains are good. Increased fiber is good. You can always add psyllium husk, which is an external fiber. Making sure you are hydrated. A lot of time constipation is because you are not hydrated properly. So make sure you're drinking 8 to 10 glasses of water on the daily basis. If you can add some electrolytes to it, that is even better. And then after that, supplements. Magnesium citrate is a very great supplement. A lot of people are doing magnesium, but they do not realize they're doing magnesium oxide. And magnesium oxide is very, very irritating to the gut. I will not recommend doing that. Do magnesium citrate. That is a more gentler version and does help with constipation issues. So that is good to do that. If that is not working, then you need to get checked yourself for SIBO. So SIBO is a very major cause of constipation, because that overgrowth of bad bacteria in your gut produces methane gas. And methane gas basically stops the peristalsis movement in your gut. And that peristalsis movement is what is like leading to bowel movements. Okay, so that's the reason very, very important to check for SIBO in case the other things which I mentioned is not helping you with your constipation. And again, good probiotics, right? So probiotic rich foods, hopefully you are paying attention and you will now have the list of probiotic foods. Otherwise, adding the probiotics, at least 30 to 50 billion will be very, very important. So that is something that you can do to help with your constipation issues. Somebody has this question about typhoid. I don't specialize in typhoid and I have no relation with it. So I will not be able to help you with post typhoid infection inflammation. So I apologize for that. All right, let's see what other questions we have over here. Rheumatoid arthritis and recently diagnosed with vasculitis, remedies for it and things. So this is a very important issue, right? You know, people don't understand, once you have one autoimmune disease, you are looking for a second and a third autoimmune disease in your lifetime. So just taking a medicine for autoimmune disease is not going to stop the autoimmune process. This is where you need to go to the root cause of the problem. This is where you need to heal your gut. This is where you need to heal the leaky gut, right? This is where you need to work on toxins. This is where you need to work on gut microbiome. This is where you need to rebalance your mitochondria, adrenals, and your hormones. All of these things needs to be worked at, then only your autoimmune disease gets better. For rheumatoid arthritis, some of the supplements like curcumin, which comes from turmeric, as well as boswellia, as well as omega-3s, have very good amount of research that they help out with it. But again, important thing is to have right quantities of those supplements. So Inflammapro is a great supplement which has at least 5 or 6 different herbal formulations which reduces inflammation, especially formulated for autoimmune disease patients. So I will highly recommend that, because it has all the things I'm talking about in terms of anti-inflammation things. And plus omegas between the ranges of 1000 and 2000 milligrams. Okay, a lot of people get fooled by omegas, by the which are available, are not good qualities. They have high mercury, plus their omega levels are very low. You need EP and DHA between the ranges of 1000 and 2000 milligrams. Again, Both of those supplements are on our formulary. I will highly recommend you to start doing those with the diet that we were talking about. I think that is going to be useful for rheumatoid arthritis patients and vasculitis also. Terry has this question: have you studied spirulina and chlorella for thyroid health? Yes. So in fact, there was a research study done which looked at thyroid nodules. So thyroid nodules, they use spirulina, they used curcumin or turmeric and boswellia. By combination of these three, they saw that, they were able to reduce the size of thyroid nodules. Okay. So spirulina has several benefits for thyroid. So definitely recommend people incorporating that in their life. You can do spirulina tablets, which is great. You get some good protein, you get some, nice antioxidants, very nice superfood. So yes, spirulina is good. Chlorella is also great. Chlorella acts as a binder and also removes a lot of toxins from your system. And we know that thyroid is one of the places where a lot of toxins get accumulated. So chlorella is again really good for thyroid health also. So I think, yes, both of these two things, the research shows that can be useful for thyroid health. Okay. So that's good. Let's see what other questions I have over here. So, So I managed to lose 20 kgs by altering my diet, but I suffer from sluggish bowel movements, from dry skin and hair. Will these go with persistence? Well, depends on the persistence, right? But sometimes you have to dig deeper also. So that's where I said, what if you have overgrowth of bad bacteria? What if, you have too much toxins in your system? What if your gallbladder is not working? So those are all the reasons that can cause, like a slowed bowel movement or peristalsis. So if you have tried the diets, which looks like you are doing for 9 months, I don't know which diet have you followed, but the diet that we are telling you, if you try that for a couple of months, still not getting results, then it's time to find a functional medicine provider who can do special testing to look at your gut and what is going on over there. So I would recommend that. I hope people are aware over here that we do provide consultations worldwide. So because we are a completely virtual practice now. So if you have autoimmune diseases, thyroid, Hashimoto's, or gut related problems, I specialize in all of those things. So definitely go to our website or reach out to us, email us, so we can see if we can take you as a case. So that's great. Priyanka has this question: my 10-year-old has chronic hives. What can we help to figure out? So if you have chronic hives, then definitely it can be gut related, because we see that leaky gut is a very, very major problem for skin issues, because a lot of times the gut problems actually get reflected in the hives. Okay. So he can also have something called MCAS, which is and histamine intolerances. So those are also important terminology you should look into, as well as leaky gut problems, as well as gut microbiome is important to look at. And then systematically working on inflammation and all the other pieces. Hopefully that will be helpful, because I think I read before you have done allergy testing which was negative. So he might have something called food sensitivity. Okay. So that is another thing to look into that. So he will require more work. 10-year-old, very difficult to say, because obviously a lot of different parameters are there. But yes, by working on these root causes, leaky gut, toxins, histamine intolerances, food sensitivities, you should get an answer over there. So that's great. Moisa has this question about I have diarrhea, IBS, diarrhea piece of it for 7 years. Suggest something. So first of all, working on the diet that you mentioned, that should be helpful for you. For IBS diarrhea, actually colostrum supplements work really good. So colostrum supplements which has IgGs in them, those are immunomodulators, which basically gives immunity to your gut, and that works good for the diarrhea piece of it. Sometimes using some kind of binders are also useful, which are charcoal and chlorella like kind of binders can also be useful in that way. And then improving your diet, definitely removing dairy and gluten should be a top priority. And I think that improves a lot of times the IBS diarrhea piece of it for a lot of people. So I will recommend doing that very, very strongly for you. Okay, great. So wonderful things people are going through. Suffering from SIBO, what protocol shall I follow? Shall I take probiotics? Well, that's $1 million question. There is SIBO is one of the difficult things to treat. There are two routes. One is the antibiotic route, which is rifaximin, and depending on what kind of SIBO you have, either hydrogen or methane. But rifaximin is an antibiotic, plus sometimes people will add neomycin if you have methane. What I believe is that I have never seen anybody getting long-term benefit from those antibiotics. So SIBO is a systemic disease. First of all, we need to use certain herbal protocols, which are Candibactin AR and BR, which helps in removing the bad bacteria. Simultaneously, we need to repopulate your gut with good probiotics at the right time, which are SIBO safe probiotics, so that your gut gets better. We have to work on leaky gut aspect of things. We have to reduce inflammation in your gut. Plus, we also have to support your gut immunity so that that bad bacteria doesn't come back. Okay, so all of these steps needs to be taken for SIBO. So it is a 4 to 6 months protocol that you will have to go to. A lot of people are doing low FODMAP diets, also, which helps a little bit with SIBO, but again, that doesn't give the long-term benefit, because again, the root cause is not the SIBO. The root cause is the gut dysfunction, which are multiple levels. The gut has been destroyed. So you have to work on all of those multiple levels and heal your gut one by one. Okay. But as a good place, if you want to start, as I said, like a gut bundle is good, which is gut restore, which will help with the leaky gut. The probio restore will give you the good probiotics. And then the Inflamma-Pro will help reduce inflammation and things. But that is not a complete SIBO protocol. So for a complete SIBO protocol, definitely you need to work with a functional medicine provider. But at least these supplements and the diet will be a good place to start. So that's great. So how do we get the blueprint of the today's presentation? So we don't have a blueprint of the today's presentation, but I have this handout for the 1 day routine. So we are going to post the link into the chat section now. So that way you can download it. It's a free to download. It's a Google form. So let me share with you this handout, which is based on today's presentation, which gives you my morning drink, my morning smoothie, as well as other options for the day that you can do. So that way, if you follow that routine for at least 3 to 4 weeks, you should start seeing some difference in your gut. Okay. So free to download. Here you go. The link should be coming up in the chat section for you any point of time. So that way it will be helpful for you. Great, wonderful. So that's great. We are coming to the end of the session, as you know. So again, I really want to thank you guys to joining us, showing all your love over here with me. I'm in gratitude for you guys to take some time out and showing up for these live sessions, sharing our videos with others. We keep on getting emails and messages from so many of you who are actually looking to get help and wanting to get better. And also sharing your success stories of how you followed certain videos and certain things, and that helped you a lot. So please, keep sharing your love. I am really thankful for that. Keep sharing what kind of topics and things you want me to make videos on in the future. We'll keep doing these live sessions every week. So keep showing up over here and ask other people to join also, because as I said, every week the plan is to bring up some new topics, some kind of educational thing that maybe will be helpful for you. So next week I think we are going to talk about again more inflammation related topic. I think I'm thinking about maybe some natural supplements that people are interested in using. So maybe we are going to cover that piece of it, and then probably detoxification and other things also as we come along. So yes, my team is spending a lot of time, organizing and doing these things. So thank you so much for my team. And again, I thank you guys for joining us over here. Keep putting your questions. And again, I apologize if you are not able to cover all the questions. Those are very difficult, as you know, to cover all the questions, that we can do. But yes, if you want to buy the supplements, please do so. They are really good quality. We have 2 pharmacies now. One is in United States and one is in India. So wherever you are located, the United States pharmacy ships worldwide, while Indian pharmacy only ships in India. So yes, good quality supplements that will be useful for you, and keep sharing your love. So again, really thank you for that. So I hope you like this, and then we'll keep sharing more information in the future also. And then we will go from there. So again, thank you so much for doing this, and I apologize again if I were not able to take all the questions. But yes, like keep coming over here and we will keep trying to answer as much as I can. So again, thank you so